So we're talking about core strengthening and lower back pain. And so if you've had lower back pain for a short period of time or a long period of time, when you look up different treatments, core strengthening typically pops up. And we see that in the research too. And we're seeing that core strengthening definitely has a part in improving and curing lower back pain. But is it really core strengthening? And what types of core strengthening is involved? Is it Pilates? Is it yoga? Is it stretching? Is it strengthening? Is it aerobic work? What does the research really show on those things? And then what actually works clinically? And what do I see actually work in front of me when I'm treating patients with lower back pain? And then we got to talk about the one thing that people always miss when they're trying to use core strengthening exercises to improve their back pain. All of those things are going to be talked about today. So let's get into it and let's have some fun along the way. So it's hard not to talk about core strengthening and lower back pain. And when you are diving through the different treatment methods out there and you're looking at the research, core strengthening typically comes out as something that we should consider when people have acute and chronic pain. So if you've had it for a short period of time or a long period of time, what we're seeing is that when you do different types of core strengthening, you're going to notice improvement in pain and disability. So how you feel and what you're able to do during your day. The trick is like figuring out what works best and in what way and what applies to you. And so when I'm working with clients, we're diving through all of those things. And so if you want to learn more about those things of the why and how, keep watching. If you want to skip past that, and I'm going to show you a little clinical snapshot of what I do with my clients to improve their back pain and they're wanting to learn some core strengthening, we're going to address that towards the end. So just skip towards that if you're more interested in that. But to get there, it's good to understand the why and the how. So the why really comes from the research. Like, what are we seeing in the research to look at core strengthening and lower back pain that applies to you? Well, we're seeing that conservative measures usually come out towards the top. And so things that don't involve putting something in your mouth or being injected with something typically come out to be a better intervention than things that are more invasive. And so conservative measures include walking, strengthening, stretching, yoga, Pilates, core exercises, resistance band. I mean, you get it. It's things that you do, right? You're actively doing those things. It also includes hot and cold, but that doesn't actually move the needle in, core strength. And so when we're talking about core strength, we're looking at different things such as yoga, Pilates, band work, walking, squatting, like all of that stuff engages our core in one way, shape, or form. And so when I'm working with my clients, I'm trying to consider the best option for them. And the research, when you're looking at large studies such as systematic reviews and big population data, we're starting to see, Pilates come out a little bit. And so that was really intriguing to me. And that's something that I don't explicitly do with my clients. I know I have plenty of clients who do Pilates, but then I'm like, okay, it's like, what makes Pilates different? Well, when I started thinking about it, I started seeing that Pilates, focuses a lot on moving the upper body and lower body at the same time and having a lot of mental engagement at the same time that you're doing that. And so we're looking at mind-body connection, so how to activate something, the connection from your brain to the muscles, and then what you're doing while you're doing that. And so when I started thinking about more and more, I'm like, well, that's exactly what PTs and such as myself do. And we're trying to look at what applies to you in that moment, teaching you how to activate it, and then also teaching you what it should feel like during the movement. And so I'm like, okay, so like Pilates teams are coming out on top, but maybe it's more of that mind-body connection of spending the time learning from somebody on what something should feel like before you just go gung-ho and try to do it on your own. I mean, guys, that makes complete sense. And so when you're trying to improve your back pain and do core strength at the same time, don't be upset if you have to get some help. Like if somebody having that guided exercise and the guided intervention, there's something to that. And that's why people see me. They need that help in that moment to help dial into their body and get that feedback. And that feedback not only comes from you, but externally, what people are seeing and feeling as you're doing it. That's super, super important. And so the interventions such as Pilates can give us just an avenue to improve our strength and do it intelligently along the way. Now when I'm thinking, okay, so if we're doing Pilates or any other type of exercise and really having some feedback along the way, how much needs to be done? And this is where we've missed the boat in the past, in that just like medication, let's say hypertension medication, and so if you don't take enough of that, you're not gonna have a reduction in your blood pressure. That makes sense. If you don't do enough of core strengthening, you're not going to have improvement in your core strength, AKA your lower back pain. And so when we're looking at improving the core strength, and we want to make sure that we're doing it in the right way and the right dosage, that's when things really start to come together. And so If we're looking at how much is actually needed, well, we know more of that for hypertension medication. We know less of that for exercise, but we're starting to see the guidelines come out with some really good evidence in saying that, if you're around that 120 to 150 minutes a week of moderate intensity exercise, that tends to move the needle on your physical health. Well, that makes sense. And there's studies to show that if you do kind of around about that amount of strengthening for your core, you're going to have improvement in core strength and then also lower back pain at the same time. And so considering those things, when you're trying to figure out how much core strengthening needs to be done, that could give you a really good direction and a really good goal point. And so when I work with my clients, we're looking at 4 to 5 days a week of core strengthening, keeping that up for 6 to 8 weeks. And if we do that, we're going to hit those markers, and I've seen people improve dramatically. And so it's not only that core strengthening is effective, but how much is done is also needs to be considered. Now, when we're trying to put that all together, what I have seen work clinically, actually in patients who are in front of me, is that every other day they're doing some sort of core strengthening, whether that be, resistance band work, doing squats, resistance training with actual weights, yoga, Pilates, those types of things. It's really about connecting your mind and body, so knowing why you're doing something, doing enough of it, and that can get the job done. And so when I'm working with clients clinically, there's a lot of things to consider, but if I'm just looking at how much needs to be done to improve their core strength and lower back pain, those are the markers that I'm thinking in my head. Now, I want to spend a little bit of time showing you what that looks like and feels like. And so I want you to break out that yoga mat or get on the floor. Don't recommend the bed, but just get on the floor, get a pillow underneath your neck, and we're going to go through some core strengthening in the manner that I would give somebody who has lower back pain that wants to build a stronger and more resilient lower back using core strengthening. And we're going to focus on the mind-body connection. And I'm going to teach you what you're going to be activating and what it should feel like, so you can at least have a great start and let that translate to other things you're doing in your life, whether it be other strengthening, but let's learn what that should feel like. All right, I'm going to get ready, but I'll see you guys in just a second. We're going to do some core strengthening to help build you a resilient back. All right, let's get started building you a stronger, more resilient back. So go ahead and lay down. All right, you're gonna have what we're called a hook line position. This is a neutral spine. You're gonna have just a normal curvatures in your spine. It's very comfortable. We're gonna learn the why. So why are we doing this? What muscles are we activating and why? So this is that mind-body connection, to build that connection between your brain, and we're gonna focus on that deep core muscles first, your transverse abdominis. So it's a drawing down maneuver. And what you're gonna hear me is breathing out. And as I'm breathing out, I'm pulling my belly button down towards the mat, and I'm flattening out. And what you could do is just put your fingers above your pelvis, so the bones that are really hard on your side here on top, and you're going to push down and you're gonna draw in until you feel a flicker of activation underneath your finger. If this is where you need to start just to learn how to activate it, that is what it is. I often spend 5-10 minutes of this with a client, and we're learning the muscle that we're trying to activate and develop that connection, and it's the transverse abdominis. So you're going to breathe out, suck your belly button down, hold that contraction, 1, 2, 3, 4, 5, and relax. Breathe out, pull down, 1, 2, 3, 4, 5. Now what I'm doing with that hold is just developing that neural connection, learning how to activate it. 1, 2, 3, 4, 5. Relax. Keep going. 1, 2, 3, 4, 5. And then last one. 1, 2, 3, 4, 5. So that's the deep core muscle. It kind of brings things together. Now your rotary stabilizers are your obliques. And so what I'm going to do here is I'm going to draw in that belly button, and then I'm going to try to bring my left shoulder to my right knee, and then my right shoulder to left knee. And you're gonna see that rotary movement here. And I'm if I'm having my arms across my chest, I'm kind of driving the right elbow to the left knee, and then left elbow to right knee. So I've done 4, 5, 6, 7, 8, 9, 10, shooting for 20, 11, 12. Now, I'm gonna keep going here, but just remember, if you have discomfort, we're not avoiding discomfort, but we're flirting with it. So let's say I have pain throughout half of that range of motion. then I will stop half of that range of motion. It doesn't mean I'm going to avoid it. It means I'm just going to let it relax and listen to my body. That was 20. So we've done 20 of those, and those were the oblique work. And so now we know what the obliques feel like to get that rotary work. We know what the transverse feels like to get that deep kind of stabilizing component. And then we're going to do the rectus abdominis, which is the six-pack ab. And we're going to curl up and come up. Curl up and come up. Now, the rectus abdominis is responsible for pulling your rib cage towards your pelvis. So that's what you want to think about doing here. Rib cage towards pelvis. 5. Now, if you want to support your head, you can. A little chin tuck and hold that head and come up. Right? This is just essential core strengthening. And now remember, your core is much more than your abdominals. So you're going to see that in just a second. Your core is everything in the middle of your body that provides you with proximal stability. So stability of your spine, pelvis, and your ribs, to give you distal mobility. So you could do things with your arms and legs, such as bend over, squat, etc., and not feel like you're going to feel unstable or not resilient. So remember, your core there, that was your rectus abdominis. You're going to do 20 crunches, and then we're going to relax. And now we're going to work on the low back musculature, which comes from a simple bridge up and back down. Okay, we got 10 bridges here. 3, 4, 5. And if you feel your core, what I want you to do is focus on that drawing in maneuver, the transverse with the bridge. 7, 8, 9, 10. Remember when we talked about dosage, right? We want to make sure we're doing enough to make change. So this core, your core strengthening regimen here should be about 15 minutes long. I'm not going to make it 15 minutes long today because I just want you to double it up. So you'll just repeat it all again when you go through and just use the video as your guide. But you're going to know that that's going to be enough to give you that core strength that you're looking for to move the needle on your low back health and resiliency. So now this is a low back exercise. So you may feel it in your lower back, just above your pelvis, the lumbar spine, L4, L5, S1 area, and back down. Now, if you're feeling a little tight and stiff, just give yourself a little love, a little bit of a need a chest hug. That is completely fine to do. And just absolutely okay. Just listen to your body. Now we're going to progress that core, the bridge work. So you're going to straighten one leg. You're going to go up and down, up and down. Anything we do with one leg, there's 3. Single leg bridge should feel it in your hamstring and your glute. 4, 5. We're going to switch sides. 1, 2, 3, 4, 5. Guys, anything we do on one leg is much harder. So I'm doing 5 reps, because if we're having some lower back pain, 3, 4, 5. Remember, we don't want to do too much. We want to do enough to make change. So sometimes that means lower reps, or lower reps and more sets. So we just do it more often, or we take breaks more often. And as we're going through this, we're establishing that connection and what we should feel. So I want you to do just set back to neutral here. Do the transverse abdominis, just relax your back and spine. And feel that. Feel the deep core work. Now, if you're like, Michael, I don't feel it, that is okay. Most people don't feel it right away. Just keep practicing. But it's the drawing in, and what I'm feeling for is just tightening underneath my fingers. So we've done a little bit of bridge work. We've done the single leg bridge, which is a killer. And now we're going to move into just a little bit more of a higher level activation called the dead bug. So dead bug exercise is knees 90, tabletop position, hands here, and we're gonna drop that right leg down as the left arm comes up, and left arm as right arm as left leg goes down. So right leg, left arm, right arm, left leg. Now what I'm trying to do is maintain that transverse abdominis contraction here. Right? So we're getting that stabilization movement, proximal stability, so body stability while the arms are moving. If we can do that, if we can build this strength, you will be able to do more and feel less in your back. So be more active during your day and feel less back discomfort. Because if you can get this strength, this translates to so many different movements. Now I'm stopping because I start to feel my lower back arch and I lose this deep core activation. Just being real with myself, like that is where I am right now, and that's okay. All right, so you're gonna keep going here and keep doing this dead bug until you feel a little bit of a burn, or you feel like your form is losing it, but I'm about 15 or 20 reps here. 9, and I'm gonna stop right there. Start to feel like I'm losing my form. You could tell you're losing your form. Things just start to feel weird. Maybe you're feeling low back pressure, or maybe you feel like you're speeding up. And so we'll tend to speed up when we tend to get tired. And that's okay too. So we've done the dead bug there, right? We've done about 15, 20 reps there. We're gonna gather ourselves with that core strengthening again. And what's great is you can do all of this lying down. You could just get comfortable and you're gonna feel a little bit of burn, So now you're gonna be in the hook lying position. This time you're gonna be up, okay? And then you're going to straighten your right leg and bring it up towards your left elbow. And back down, left leg, bring your left knee up towards your right elbow, down, right knee towards the left elbow, down. Okay, there's 4 right there, and we're gonna repeat that. We're just driving and getting that rotational strength, building it up, right? Proximal stability. I'm doing that little bit of drawing in maneuver, just engaging my core throughout the arm and leg movement, right? We're starting to see some Pilates principles there. A lot of these people and different things are doing the right things and they're packaging in ways, but what we're seeing is if you're doing that mind-body connection, thinking about the why as you're doing it, you're gonna have a better outcome. Now, I did about 10 there. I'm gonna stretch out. I'm gonna pull my knees to my chest and just relax my body for a moment. And that is okay, right? I've seen this work with a lot of clients, and when we're feeling some low back pain along the way, we're just gonna listen to our back. You'll see me do a little bit of rocking side to side. That is absolutely fine. All right, for our capstone exercise here, remember, you're gonna repeat this whole program 2 to 3 times to try to hit that 15-minute mark. But for our capstone exercises, our palms are gonna be flat against the ground, okay? And now I'm gonna drive my shoulder blades together a little bit and push my hands in the ground at the same time, and then lift up, okay? Extend, extend. So I'm engaging my back, my upper back, and my lower back, my glutes, my hamstrings, everything at the same time. Remember, your core is much more than that 6-pack abs. We're gonna feel a burn in our back, our upper back. Remember to keep driving with your arms into the floor or mat. We're gonna feel your glutes activate. We're gonna feel those hamstrings. Remember, the arm and leg movement gives you that stability or that strength at your core. So that's why we're including it. You do this 4 to 5 times a week, every other day if you're just starting. And you do this for 4 to 6 weeks, you will notice an improvement in the ease of these exercises and in your back discomfort. You will be building yourself a stronger core to make yourself more resilient. I promise you, I've seen it. The problem is people get the dosage wrong. They don't do enough. So don't give up. If you're having discomfort, listen to your body, rest when you need to. Don't push past the discomfort, but flirt with it. So what I want to challenge you to do is do that entire program 2 to 3 times through, or just once if you just started. Doing it every other day, moving it to 4 to 5 days a week, and then stick with it for 4 to 6 weeks. And I know that you will improve in strength. Now, there are other exercises to do that are easier, harder, and there's a lot of variability, but those are just some that I've seen people do well when they have lower back pain and discomfort. Enjoy those exercises. Let me know what you think. Let me know if you have any questions. Do it 2 to 3 times through. And if you're unsure, just look at the description. I'll put it in there. But otherwise, guys, keep after it. You kind of know the best way to start right now with blending with evidence and clinical experience. So just get after it. Don't give up, but always take care of yourself and enjoy the ride.